set that stage to talk about how all of this relates to the work that we do in outreach and enrollment. We reached out to Dr. Sharon Brown, who is a very dear colleague. She's executive director of the Tampa Bay Healthcare Collaborative that I am quite honored to serve on their board of directors. And Dr. Brown does a really amazing job of talking about what health equity actually means, which I think is an important common denominator before we get into talking specifically about the opportunities that we have to do outreach and enrollment. So would love now to introduce you to Dr. Brown, who's going to share some information specifically about health equity, as well as some information about her organization, and if you're not already involved, how you can get involved. Dr. Brown.
Thank you, Melanie. Greetings, good afternoon, everyone. I'm grateful to be here. Excuse me. Thank you for asking me to be here. I'm honored to be able to contribute in these few short minutes as we get ourselves grounded in common understanding and common language around what it means when we're saying health equity. So that's what my brief presentation is going to be about. It's going to be our grounding in health equity. And so before I get started on that, I just would like to share a quick video.
When people talk about health equity, they tend to use big words like socioeconomic, social determinant, redistribution, suboptimal, and disadvantaged. What they really mean is unfair. The fact is, your zip code, your skin color, your income, or your family background should not keep you from being as healthy as you can be. The Tampa Bay Healthcare Collaborative was founded to overcome the structural injustices, policies, and practices that are barriers to healthy living. We're talking about more than just equal access to good doctors and hospitals. We're talking about changes to big problems like poverty, discrimination, fair pay, equal housing, and education. It's a big job. But thanks to the inspiration we get from our members, partners, and donors, we are able to address these issues and find ways to make life healthier for so many in the Tampa Bay area. 2020 was a tough year. The pandemic has exposed many of the inequities of our society for everyone to see. 2021 brings new hope and new challenges, but we believe that if we collaborate, innovate, and activate, we will play a large part delivering healthy living to everyone in Tampa Bay.
So again, I am the executive director of the Tampa Bay Healthcare Collaborative, and that video briefly shared with you who we are and what we do. Essentially, as stated in the video, we promote and advance health equity to benefit those who are negatively impacted by unfair policies and practices that result in poor health outcomes. We believe that everyone, and I would argue that everyone here also believes the same, that everyone should have a fair and just opportunity to be as healthy as possible. Unfortunately, though, that is not the case, as there are barriers to that we know, and these barriers are avoidable. Health inequity has been an issue now for centuries. I almost said decades, for centuries. And the barriers are all connected to socioeconomic status and other demographics such as ethnicities. A few moments ago, you heard about how the African American community is impacted on a deeper level as it relates to COVID than other communities, and even before COVID, because what we hear is that COVID has shown the light on the inequities when in reality the light has been on. It's just, did you take your shades off? So what COVID has done, it has knocked the shades off of everyone's faces to say, oh, this thing is real. We can stop pretending that it's not. There are real barriers that are created by human beings. And what the Tampa Bay Healthcare Collaborative is about, it's about people who choose to come together to figure out how to address these issues, whether it be through advocacy, whether it be through building capacity, whether it be through increasing awareness. Because what everyone knows who's a part of the Tampa Bay Healthcare Collaborative, and I believe you all know, and that's why you're here today, is that the problem of inequity is too big for one person or one organization to solve on their own. No one person or organization holds the silver bullet. And so we firmly believe that collaboration is absolutely the key to solving this problem, and that we do that together. And so today I know Melanie will share some information, and she already has, regarding how collaboration is being used to advance enrollment, which in turn advances health equity. And in addition to that, I'd like to share some other opportunities through the collaborative, because we all work together here. So one of those things, one of the ways that we help to bring people together to help them connect, so that people together who work in the social determinants of health space can look at their own strengths, leverage each other's strengths, and figure out, okay, what can we do? What do we need to switch up? How do we need to adjust to move forward and move the needle on health equity? And one of those things is what we just launched recently last month. It's the TBHC Collaborate app. And this app is as good as many people that get in it. So we're encouraging everyone to download the app from your Apple Store or your Google Play Store. And if you're someone who doesn't like to mess with apps on your phone, you can also do it on your desktop. And we'll share the link shortly when I'm done speaking. But what you can do in the app is, number one, view the entire network, and the network involves everyone who is in the app. So we're always constantly working weekly to get more folks in the app. And you get to find find folks who may be in your space or may not be in your space. And all the spaces are the categories of that came out of the community health needs assessment. So you'll find mental health, depression, obesity, diabetes, substance abuse, so on and so forth. You're also able to reach out to people and connect to explore potential collaboration opportunities on initiatives, or potential collaboration opportunities on funding, because we know that funders love to see collaborative efforts. And another thing you're able to do, there's more, but these are the big overview highlights. Another thing you're able to do is share the initiatives that you have coming down the pike through, and find out the initiatives of others. And so we encourage you to jump in the app and create this profile, because even what Melanie shares more of with you today is work that you can be discussing through the app. Another way you can get involved is through our Collaborate Unconference, which is actually next Thursday, where again we're bringing it's driven by the community health needs assessment. So we're bringing together all who registered, really, to lead them through a process, an appreciative inquiry process, using the Unconference framework, where they self-select, who do I need to connect with? Who do I want to collaborate with in the areas of mental health, behavioral health, access to care, which is what we're discussing here today, and also exercise and nutrition, those top 3 prioritized needs for our area. We have other impact councils as well, and you're able to find out more about them on our website. But this is an immediate one that's coming up. So again, all of this is tying back to the work that you're doing here today. And finally, your organization can become a member by going to our member page, or you as an individual can become what we call a connector by simply joining our list, and you'll be informed of all the opportunities that we send out every month or every week. Sometimes we send out things weekly, but definitely every month. So I believe that, in the grounding, I was asked to just kind of get us in this place together where we all know that health equity matters, but ground us in the word escapes me, but not the practicality, but to be able to touch with our minds the realness of it. One thing that I used to say was that the person's health across town that I don't know matters to me. And what we absolutely know for sure at this time is the person's health across the world matters to me. And so if the person I don't know across town is healthy, that makes for a healthier community. So as we're doing this work to expand access for people that we don't know, remember that it's impacting so many others' health, not just that one person, but everyone in the community. So this work is really helping us to gain ground on firming up the foundation of a healthy community. And so again, Sharon Brown, Tampa Bay Healthcare Collaborative, and that's our website. You can reach us. And what I'm going to do is just drop everything in the link and hand the mic over to Melanie.
Thank you so much, Dr. Brown. Thank you for your passion for this work. And I feel like it's been just an absolute honor to have worked with you over the last year, almost a year and a half now, right? Mm-hmm. In terms of your leadership for the collaborative and what that has meant for our community. We're so grateful again for both of our speakers, because what this has allowed